The broadcast is now starting. All attendees are in listen-only mode.
Right. Good evening, everyone. Welcome to this evening's webinar. Thank you very much for joining us tonight. We have something a bit different and a bit special this evening, that we're joined by Mahesh Gandhi, who's quite a well-known homeopath overseas, but I think it's the first time he's been teaching in the Australasia area, so it's new for many of us. So what I thought we might do is have a chat and find out some of the details of his practice and what he does in his clinic, and how he applies his method. What we're going to do, we're going to have a little chat with Mahesh, but if you have a question, please type it into the question box, and if we get opportunity, I'll pass your questions on to Mahesh and have him answer them across the evening, but we'll have a little chat and get started, okay? So welcome, Mahesh. Thank you very much for joining us this evening. It's very nice to hear from you.
My pleasure.
Yeah, thank you. Perhaps you could start by telling us a little bit about your history and your background for people in Australia who may not have heard of you and your work before.
Hello everybody and good evening. I am Mahesh Gandhi, as I've already been introduced by Greg, and I am a psychiatrist by profession, and I passed my MD master's degree in early 80s, and then very soon I was a little disillusioned by the way we are treating in the psychiatric practice. I was hoping that I would do more of psychotherapy and talking to people, but by that time the whole science had become very biological, and we saw it was more of prescription of drugs rather than anything. And then I was looking for other alternatives, and I got into this homeopathy, and that's where I am now. And now I'm traveling all around the world trying to share my experiences. Because of my psychiatric background, I see more of psychiatric patients, and this has been one way, in a way, I'm very fortunate that this is the scenario, because I've got a little more experience treating all these various types of psychiatric disorders.
Yeah,
So yes, Greg.
Yeah, that's actually very interesting to me that you started being a psychiatrist and then came to homeopathy afterwards. I think in Australia it's often very different, that people start perhaps knowing herbalism or naturopathy or some medicine more like that, and then discover homeopathy, and as a result become more interested in psychotherapy and mental emotional areas, and learn about that through homeopathy. It's interesting that you're the opposite, that you learnt psychiatry and psychotherapy first before you came to homeopathy. Perhaps you could tell us about psychiatric disease is maybe an area that many of us as homeopaths struggle with, because it can be much harder for us to understand our homeopathy language in a psychiatric disease. Perhaps you could tell us something about...
Yes, Greg. The thing is, people are a little scared of treating psychiatric disorders, and they feel that probably it's a little, we don't have to get into that danger zone where we have to treat these psychiatric. But with my experience in seeing so many patients, I believe they are as treatable, or sometimes even better treatable, than many of the cases we get as homeopaths to treat. So just a little background. Psychiatry began with psychoanalysis by Freud. And the whole idea was going deep into the person, trying to understand the person and then treating him. So the psychotherapy was the beginning. But what happened was that psychotherapy had a lot of limitations, because sometimes the analysis, a lot depends on how the therapist is going to analyze the case. Very often you cannot do psychotherapy on people who are not psychologically minded. Psychotherapy may not be very useful in physical disorders, or in children where they cannot really express what they are going through. So, and the whole onus of improvement was on the patient. It's like sometimes you know what is your problem, but you cannot change. It's like, I know I'm jealous, but I don't know what to do about it. So there is awareness, but there is no real move in the direction of being able to have a control over it, or be able to get over it or circumvent it. So what happened was there was a lot of disillusionment with this, and in 1950s the drugs started coming, chlorpromazine and many other drugs, and gradually the whole psychiatry moved towards the biological model of treatment. But I believe homeopathy is a very good bridge. We can use all those things which a psychotherapist does. Understand the patient, but rather than resorting to all these medical drugs, the chemical drugs which we are often prescribed, these antidepressants and SSRIs and antipsychotics, we could give them homeopathy medication. So previously they thought that we understand patient but we didn't know what to do. But now I think there is a solution. In a gentle, nice way, we can treat with homeopathy. So we have to understand what psychiatric illnesses are. I don't see actually psychiatric illnesses as illnesses. I don't see them as some viral infection or something which has come from out and invaded into your physical being. It is just various stages of your ego breakdown. I don't know how many of you really understand this ego, but very often I use this Freudian concepts of id, ego and superego. And people, if you are aware about the sensation method, you know that we have an inner song. Inner song is that which is within. This is very actually what you are. So Freud talked about id. Id is your instincts, the sexual and aggressive drives. But we see it in a much broader context, and we see id as the other song. Now this is where Freud also believed that your entire it is a storehouse of the energy. So everything that has the maximum power, it is all the time trying to express itself outside. So we have this id at one side, then we have this ego. Ego is what Shankaran calls as identity. But actual identity is id. Id means ID. Wherever you go, they ask you, what is your ID card? What is your ID? ID is your identity, right? So that is your identity, because I might be Mahesh Gandhi, but who I am really inside is the one which makes me very peculiar. Let's say if I am pulsatile or laccaninem or calibromatum or whatever. That is me. That is my true me. That gives that difference. It makes me different from others. So this is that id. And ego is what you develop after birth, during the natrum phase of development, where when you are born, you look at people, there are many other people like you, and then you say that there are so many, then who am I? Then you develop a social identity, an identity to relate to people in the world, and that is called ego. And then of course we have the superego, which is because of the parenting and the way you have been brought up, your cultural background, the upbringing, which is the negative programming. Don't do this, don't do that, this is not allowed, the religion, and all those different aspects, which is after you are born, certain value systems which you live with. So when there is a problem between this id, ego and superego, you have a psychiatric problem. So how do we face the world? We face the world with ego. So whenever ego is under pressure, we experience anxiety. Let's say there is a lot of pressure from your inside, which is trying to threaten the ego. Or there is a lot of external pressures, or because of your negative programming you have a lot of guilt. Then the ego, that social mask with which you face the world, is under stress, and when it is under stress, this is what we diagnose as anxiety. So anxiety is nothing but a signal for us to see within what is really happening to us. What is the problem? There is something in your psychic apparatus which is trying to destabilize you. And you can take the right action. Unfortunately, we resort to all those anti-anxiety or anxiolytic drugs and just push down that anxiety, and we are not aware about that anxiety. But anxiety is actually a signal. When it becomes too much, let's say your inside is trying to express outside and your ego is trying to be strong, and when there's a struggle, the ego is trying to be tough and the inside, your id, is trying to come out, you suffer from obsessive compulsive disorder. There's a fight within your being. Am I making myself clear, because I'm talking about too many concepts?
Yeah, no, I think very clear. Thanks, Mahesh.
Okay. And then if finally ego breaks down, this is what we call as psychosis or schizophrenia. So what happens is, schizophrenia is nothing but when you express your inner song outside more floridly, and there is nothing to filter it or stop it. So what we talk about schizophrenia is not actually an illness. It is just that the balance between the ego and the id has gone, and now you are more expressing yourself. Now, for example, when I'm talking to all of you, I have to remember I am Mahesh Gandhi and I'm relating to all of you. I cannot allow my inner self to express itself too much. But if I start talking my inside, I might start sounding very irrelevant. I will start talking about some of my delusions and things like this, which will make you all feel, in which world am I in? That is schizophrenia. So if you understand the dynamics, it's very easy to treat. In a way, psychiatric illnesses just is a window to your inside, and when you understand what he's talking, what he's really saying, we can really help this patient. It is like they are giving you all their peculiarities in a very, very easy way.
That's,
Would you like to ask some questions? Anything?
yeah, we've got quite a few questions coming for you. A
Okay.
question from Linda is wondering, with your background as a psychiatrist, and now that you're
Hmm.
practicing as a homeopath, do you still use the classification system in the DSM, or how does that relate to your understanding of homeopathic symptoms?
DSM is not, I will not go directly with DSM. DSM has many reasons for being there. It is also like when I talk about schizophrenia in India, I would like that when I talk about schizophrenia, it is understood exactly in the same way in Australia by some psychiatrists. Before, what would happen is these terms were very loose. I in India would call somebody who has got just an acute psychotic episode as schizophrenia. But somebody who's listening to in Australia will get a complete different idea about what I'm talking if they don't understand, if you are not talking the same language. So DSM are those criterias where you have, you have to have out of 5 points, you have to have 3 points to be selected. This is more for research. And this DSM goes on changing. Every few years you see DSM 1, 2, 3, 4, 4 revised. It goes on changing. So what I use is, of course I know all of that, but what I use is the basic things. Anxiety, panic, phobia, obsessive compulsive, schizophrenia, and sometimes I even use it very loosely. Like when I say schizophrenia, I would also include a lot of other psychotic disorders to be included in it.
So it's interesting when you spoke earlier about the id and the ego and the superego, and to me that often reminds me of some ideas that Sankaran has spoken about quite a lot in terms of compensation and seeing polarities of symptoms within the same medicine. Do you see a connection there, or do you treat that somehow differently?
Yes, now psychosis, when I see, I believe that it is a breakdown of ego. So when I see that patient has got an ego breakdown, how did it happen? So this itself is a very big indication to me what sort of remedies I can give. So people with a very poor ego are very strongly prone to psychiatric disorders, like people from lithium line, example in mineral kingdom. Now that lithium's line is one step before the development of ego. Ego develops in the natrum line or the identity. So people who lie above that, like the lithium line, are more prone to psychiatric disorders and especially schizophrenia. Similarly, plants, the primitive plants, the plants which are not yet completely developed in terms of evolution, are more prone for a psychotic breakdown. So I see a certain pattern in my prescription and I see some remedies coming up much more often, and this is all about what I can share. More is to give you all some hints into how to look into cases and see what needs to be treated and how you see a patient. This is very important. So ego can break down because your ego is weak. I can give you an example of a police breaking down a criminal. Let's say there's a criminal who is not telling what he has done. So what sort of treatment a police will do? If the criminal is too weak, he will break down immediately and confess, oh, I have done this. Second thing what you do is to torture the person. When you torture, he finally breaks down. So if in your state there is something like torture or something like persecution or leprous miasm is very, feels persecuted, or syphilitic miasm, who feels that people are against me. So if you are all the time under a delusion that people are against you, people are harming you, people are there to finish you, eventually ego, however strong it is, can break down. Then there are other things. If you are isolated, we see these movies like Castaway, where a person is on an island like a Robinson Crusoe. First few months he's all right, then he starts talking to the coconuts. Because by definition, human beings are a social animal. So for ego to remain or sustain, myself to remain as Mahesh Gandhi, I need feedbacks from the universe. And if I don't get, then that particular social mass breaks down. And then you start talking to yourself and muttering to yourself. So many of these things I don't know. This half an hour might be too short and
Sure.
I might appear a little confusing, but when we talk, then we have a lot of discussions and then I can give some cases and we can share. And but
Yeah,
just to give
wonderful.
you a background, this is what I mean.
So I have a question from Frederick. She's wondering, in diseases like dementia, where people become unable to compensate and interact in society anymore, would you look at this as this disease is revealing that inner song, or is it something different?
In a way, yes. Because if dementia is there, depends on what age dementia occurs. If it occurs at, let's say, age of 90 years, then it is something, it is a normal aging process. What is dementia? Dementia is an aging process. Just like we have our hair go gray, we have a cataract, our teeth fall down. So that way your brain cells become less. So if it is age related, you are 90, 95 plus, and then you start forgetting things, no big deal. But when it starts happening earlier, it's like treating somebody with gray hair because he has come at a very young age. And then you feel that things are happening prior to when it should happen. So which means there is something in your state which brings about aging faster. Like for example, Baraita. Baraita Kab, when it is born, when he is born also he is very serious, he looks old, he looks mature. Why? Because he falls in the syphilitic miasm. He is in the line of Aurum line which represent old age. So even as a child he is an old man. So if you have some remedy, your inner remedy state is of an old person, miasmatically, or because where you fall in the periodic table or whatever, then you might start showing aging processes much earlier. For example, if you're Konayam. Now Konayam is also one of the older remedies. In the age processes, it's in the, the age of that remedy will be much older. So they can have prosthetic problems much earlier than what most people would have. So it is definitely an indication. But once it is there, we cannot undo, I believe, what is already damaged. If your brain cells are gone, you cannot do anything. It's like hair which is already turned gray, you cannot make black. But you can arrest the process, slow down the process, so that this whole aging process can be made not as quick as it would otherwise happen if there was no remedy.
Mm-hmm. And what about the same for people who get disease early in their life, children with autism, Asperger's, etc.? How would you look at that?
People with autism, again, this is because they are not yet ready for the world. They are not yet ready for the world. They are not exposing themselves. They like to remain within their cocoon. For example, I'll just give you an example of things which can easily understandable. The noble gases, let's say helium, neon. These are the people who are still high up in the development. They are not yet developed. They are yet like, infants or just born or before birth. And for them, facing the world is so difficult that they retrieve or go back into their cocoon and then they look lost to the world. That is what we call as autism. So if we understand what's happening, then it is very easy. Similarly, for example, we have Helleborus, we have opium, who also look very autistic because they are in their own world. And these are also, in a way, very primitive plants. They fall into the group called magnolids, which are very primitive plants. And because of that, their way is to withdraw within and not face the world. So we have to understand exactly what is the dynamics, psychodynamics going on, in what way that inner song is expressing itself in terms of the pathology.
Mm-hmm. Interesting. And you said earlier that you use quite a lot of the sensation method in your prescribing. Could you tell us a little bit, why do you find the sensation method useful? Is it especially useful for psychiatric
I think
prescribing?
this is very interesting because, I'm very closely associated with Rajan Shankaran. I sat with him also for many years and we are in the same team together. So at one time, when we used to see cases, we were not yet into the sensation method. So what I would do is when a psychiatric patient with really severe psychosis or some very severe pathology would come, I would treat them with allopathic medications, make them normal, because I would say that till he is normal, he is not going to give me history. He is talking all crazy stuff. He is irrelevant. How will I talk with him and how will I understand him? So I would give them psychiatric medications, and when they were like so-called normal and they would talk relevantly, I would take the history. But now what happened is, as the sensation method got developed, I saw Shankaran would take a patient who's apparently normal, let's say he comes for arthritis, and then he takes them deeper into the delusion level and the sensation level, and as they go deeper and deeper, they start talking nonsense. So he makes no sense. People who are otherwise sensible make them talk nonsense. and then find the remedy when they start talking nonsense. So for me, it was very easy. Patients were already coming talking irrelevantly. So I said, what am I doing? I'm putting everything on a, you know,
Yeah.
on a platter. It's
Yeah.
like they're
Wonderful.
already deep inside. I don't have to bring them out and then treat them. It's like they're already expressing delusional level, sensational level. When somebody thinks he's a king and starts moving around, for me this itself is a delusion. So I begin with the delusion. For me it's very, very interesting
Yeah.
that if they come in acute crisis, I am much, much happier now because I can have a complete window into their inner being.
Yeah. All those
Because all
symptoms on
what
the
they talk is
surface.
from the other song. So
Yeah.
this method, I think, is really the best possible method for this sort of treatment of cases.
Yeah. It's interesting to me when you say that. I'm reminded of what Hahnemann says in the Organon when he's talking about mental disease, and how, rather than starting with the antipsoric medicine, he always starts with the medicine that matches the symptoms. Let's just prescribe for what's on top. I've never thought about it that way. For always, I guess homeopaths think psychiatric disease can be very hard for us to understand the symptoms, but perhaps we can make it simple by just taking the symptoms that they're giving to us as a gift. That's very easy for us. I think it fits very nicely with the sensation method.
Hello?
Hello, Mahesh. Sorry, can you
Yeah,
hear me?
yeah,
Yeah.
you're back again. Yes,
Just
yeah.
dropped out for a moment. Okay, so we're just about running out of time, so perhaps we might have to say goodbye for this evening. I know you have a lot of things to get organised before you get on a plane and come to Australia. But if anyone
Right.
wants to, if anyone wants to find out more about you or find some details of your seminar, it's going to be in Byron Bay in a couple of weeks' time, the weekend, Friday through Sunday, August 19th to 21st. But you can stop on Rendebar's site, the Remedy Room, which is the URL is naturopathbyronbay.com.au, and find out details about Mahesh's seminar and about his prescribing. But thank you very much for joining us this evening, Mahesh.
Right. And Greg, it was nice talking to you, and I'll be there soon.
Yeah, it's a pleasure to talk to you.
Bye.
Thank you. Take care.
Bye.